Hello, Dr. Seth Gerlach with Core Health, board-certified chiropractic internist and functional medicine practitioner. Today I'm talking about a very important pro-hormone called vitamin D. Now, vitamin D, most people know we get it from the sun, really, and our body synthesizes it. But what's the deal with supplementation? Who needs it? Who does it benefit, and what does it do? So the government recommends that we get between 200 and 600 IUs. It's just the units per day. Now, that may be enough to prevent us from getting the disease rickets, but it's definitely not the best way to have optimal health. And we'll go through that because vitamin D does so much in the body, and it's so important. So from all my years of testing vitamin D levels on people, which is extremely important, I found one person who has had an optimal vitamin D level the first time we test their vitamin D. Epidemic? I think so. So what does vitamin D actually do, and why is it so important? Well, number one, vitamin D helps control our gene expression, so how our genes are acting, whether they're turned on good genes or turning off bad genes. It's found that vitamin D has an impact, actually direct impact on 200 different genes. And so having adequate levels of vitamin D can help turn on those good genes and turn off those bad genes. Extremely, extremely powerful. Next, vitamin D is very vital for bone health. So vitamin D helps us absorb other minerals and nutrients like calcium that can help form and promote good bone formation. So when you think bones, don't think calcium as much, think vitamin D, way more important. Vitamin D can also boost the immune system. So vitamin D has been shown to help these cells called T regulatory cells of the immune system, help them function better. So those are the guys that tell us what's good, what's bad, how to turn on and turn off the immune system. And when our vitamin D levels are high, those are able to work properly. So see how this is starting to stack up, guys? Vitamin D is important for mood. How many people get the winter blues when they don't have sunlight or their vitamin D level drops in the winter? So vitamin D is extremely important for brain health, for cognition, for mood. And not only this, vitamin D helps prevent many different kinds of diseases, especially autoimmune diseases like multiple sclerosis, fibromyalgia. And one study showed that having optimal levels of vitamin D can reduce your risk of getting type 1 diabetes by over 80%. That's so profound with something so simple. And other correlations have been found with actually heart disease and diabetes and low vitamin D also. And many studies are now coming out. They're testing the effects on vitamin D in cancer. So we found out that vitamin D has been, or good vitamin D levels have been associated with preventing 18 different types of cancers, including lung, colon, and breast. So this can be extremely important in our arsenal using for fighting off disease or just promoting optimal health. In fact, there's a study in Canada that showed that 96% of women who had breast cancer had extremely low levels of vitamin D. That's a very strong correlation. And also showed that people who supplemented with vitamin D to get their levels in optimal range had a 94% reduction in the risk for metastases or spreading of the cancer, and they had a 73% decrease chance in dying early if their vitamin D levels were optimized. So super, super important. So how do we get vitamin D? Like I said earlier, most of our vitamin D comes from sunlight. That becomes problematic because we spend most of our lives indoors, right? We work inside, we hang out inside, we eat inside. But getting 20 to 30 minutes of sunlight a day with minimal clothes on so we can absorb that in our skin is vitally important. Now, the further north we go away from the equator, the sun's strength is not as pronounced, so there's less of an ability to create our own vitamin D. This also happens in the wintertime also, where the sun's strength is not as potent. Can we get it from food? Food sources are not very good for vitamin D. Cod liver oil is probably the most, and it still has minimal amounts of vitamin D. That's why I recommend almost everyone supplementing with vitamin D. You can use a liquid form. A micellized form is extremely powerful. It's high potency, so you have to use less. You can raise the vitamin D quicker. You can also use it with K2 to help balance your mineral status in the body also. Important note, we don't want to overdose or overdo it on vitamin D, so it's important to get your vitamin D levels checked, ideally multiple times throughout the year, because it fluctuates. So we want to be within a good range. I see a good range between 70 and 100 if you're getting your vitamin D levels checked. Medscape just came out with a study. They said optimally is around 75, 80. So check this out. Get your vitamin D levels checked by a functional medicine practitioner, or you can even go to your medical doctor and ask for them to check your vitamin D levels to see what they are. It's an extremely inexpensive test to run. Go get outside, get some sunlight, and if you are deficient, get some supplemental vitamin D. It's a usual dose for people can range anywhere between 3,000-4,000 IUs a day up to 10,000 IUs a day. Again, it all depends on you and your levels. So again, I'm Dr. Seth Gerlach. Hope you enjoyed the video today, and go catch some sunlight. Take care.